Hours-long lines for coronavirus PCR tests are prompting public officials to push the masses to use rapid, at-home antigen tests instead, but public health experts warn the 15-minute tests are sometimes prone to false negatives. Massachusetts Governor Charlie Baker last week said, "Rapid tests, in some ways, are a more accurate measure of whether or not somebody is actually transmitting COVID than a PCR test is," Dr. Davidson Hamer, Boston University professor of global health and medicine, called the governor's statement strong. Todd Ellerin, director of infectious disease at South Shore Health, said while there's some truth to the governor's statement, it's complicated. We asked the experts to break down the accuracy of rapid at-home antigen tests, PCR tests, and lay out when one should be used over the other. Answers have been edited slightly for clarity. How accurate are rapid antigen tests compared to PCR tests? Ellerin, PCR results, which are tested in a lab, are much more accurate. But if you look at the arc for a PCR, it can last much longer and is often picking up a past infection that may no longer be infectious. When a rapid test is positive, that's probably the point when a person is most infectious. On the other hand, if you are symptomatic and test negative on a rapid antigen test, that does not mean you do not have COVID. You need to stay cautious and you need to retake that test several times over a couple of days. Taking rapid tests multiple times over a short period of days increases the likelihood of an accurate result. Hamer, with the rapid tests, if you are positive, then there's a good likelihood that a person is able to transmit the virus at that point in time, but the PCR is much more sensitive. It can detect earlier, but may be positive before a person has enough viral load to transmit, and also after a person's symptoms have resolved and past the point of transmission. The rapid, however, may come back negative before the onset of symptoms when a person is still able to transmit, so the PCR remains the best possible test right now, despite its limitations. Are all rapid tests created equal? Ellerin, it's unclear if all rapid antigen tests are created equal, but they all have an emergency use authorization from the FDA, so there's a minimum accuracy that they needed to prove.